10, Community Board 11, Community Board 12, Community Board 13,
Here.
Community Board 14, Community Board 15,
Here.
Community Board 16, Community Board 17,
Here.
Community Board 18. Councilmember Barron, Councilmember Cornegy, Councilmember Cumbo, Councilmember Deutsch, Councilmember Espinal, Councilmember Eugene, Councilmember Gentili, Councilmember Greenfield, Councilmember Lander, Councilmember Levin, Councilmember Mizell, Councilmember Mealy, Councilmember Menchaca, Councilmember Reynoso, Councilmember Traeger. Here. Councilmember Williams.
Here.
All right. Good evening, everyone. Welcome to our May Borough Board meeting. We have a relatively short agenda tonight. We had one addition to the agenda. We also have a presentation by the World Trade Center Health Project on a post-9/11 pediatric healthcare study. The first item on our agenda is the vote on the Department of City Planning application. We're actually still a few votes shy of quorum right now, so we're going to hold off on that vote until the remaining members come in. We're 3 votes shy right now. We need 3 council members to come in order to make quorum for that vote. So once they come, we'll revisit that agenda item. Our third agenda item is a presentation by 32BJ, SEIU on good development standards. And then lastly, a presentation by the New York City Long-Term Care Ombudsman's Program. Before we begin, I know that we don't have the minutes from the April meeting. Couldn't get them finalized in time, so at the June meeting, we'll have both the April minutes and the May minutes to review and approve. So you weren't going crazy if you thought you were missing the minutes. We haven't finalized and finished them yet. She'll get those at next month's meeting. I left a couple of flyers at the beginning, at the signing table for you. Just a couple of quick announcements to go over. On Thursday, May 21st, the Borough President is hosting a special information seminar called Road Mapping for Parents of Children with Special Needs. We're going to have information resources here to help families kind of guide the education system and learn about what resources are available for their special needs children. That's 6 p.m. here at Borough Hall. On Friday, May 29th, we are having Asian Pacific American Heritage Month from 6 o'clock to 9 p.m. That event is free and open to the public, so please share that, all these announcements, with your constituents and let them know if they're able to attend that. On next Thursday, May 14th, and next Friday, May 15th, we are having a continuation of our financial literacy empowerment program. We're going to have a special session on securing Brooklyn seniors, financial literacy for senior citizens. On Thursday, it'll be at the YWCA at 33rd Avenue from 6 p.m. to 8 p.m. And on Friday, it'll be here at Borough Hall from 9 a.m. to 1 p.m. On Sunday, May 16th, Saturday, May 16th, we have our youth participation community boards boot camp. If you remember at the last meeting, we had a presentation by the Youth Council on Community Engagement about this workshop, all-day workshop for helping teens learn about the community board process and encouraging them to apply to the community boards. So if you have youth groups in your districts that you think would be interested in taking part in this, please let them know. That would be next Saturday. Lastly, 2 other quick things. On Thursday, June 4th, we're having Brooklyn Day over in Canarsie Park on East 88th Street and Seaview Avenue. And this summer, actually beginning next week, we have our school lunchtime concert series, which takes place on Wednesdays during lunch hour. We have a number of public schools that perform here at Borough Hall for the public, and there's a schedule available on the sign-in table. Let's see, we've been joined by Councilmember Cornegy's office. Okay, so we'll move on to our first agenda item, which is a presentation by Dr. Tresande from NYU School of Medicine on the post-9/11 pediatric healthcare study. Tresande? Thank you. Come right up. Yep.
Thank you for the opportunity. I realize we're competing with Cinco de Mayo, so I will keep the presentation brief. My name is Leo Tresande. I'm a pediatrician. Again, thank you for the opportunity. I appreciate that I'm competing with Cinco de Mayo, so I will keep my presentation necessarily brief. My name is Leo Tresande. I'm a pediatrician and environmental health researcher at NYU School of Medicine. And I'm leading a study where we're looking at the long-term health effects on physical health of exposure to the September 11th disaster. The study is grounded on data from the World Trade Center Clinical Center at Bellevue Hospital where I work, and it came in the follow-up of data from our center documenting that children who were exposed to the disaster in early life had an increased frequency of not just effects on their lungs in the form of asthma and other pulmonary conditions, but also early signals that there might be risks associated in terms of early heart disease and other chronic conditions in childhood. And so we received funding now about 18 months ago from the Centers for Disease Control and Prevention from the National Institute of Occupational Safety and Health. And that study examines the physical health of 225 roughly 13 to 21-year-olds who are participating in the World Trade Center Health Registry, and we're comparing their lung and heart health to a matched comparison group of 225 adolescents, roughly from the same social and demographic backgrounds, but who themselves were not exposed to the disaster. And what we're doing is trying to identify early conditions among World Trade Center exposed youth that might be the basis for further prevention and treatment to ensure the most optimal health profile as they age into adulthood. The reason I'm here today is that we are seeking your support and help in two ways. One is identifying and communicating information about the study for children who participated in the World Trade Center Health Registry who may be eligible to participate in the study. We think it's very important that youth who participated in the registry and were exposed be involved in this study because it will be a first opportunity to identify physical health effects that may be the basis for further treatment and prevention going forward. The second reason I'm here today is we're also seeking your support in identifying potential youth who were not exposed, who might be the basis for participating in the study so that we can have a really good comparison population. One of the things that's very difficult this many years after disaster is to identify whether there are true differences between an exposed sample and an unexposed population. There are many conditions, exposures, various issues that come up in the years that follow. So it's especially important that we find a population from roughly the same social and other demographic backgrounds. Participation in the study begins with a brief screener, which takes 5 to 7 minutes to complete. We provide a single-use MetroCard for completing that screener, and if indeed we find participants to be eligible, the study is roughly a single 3-hour visit wherein people provide a fasting blood sample so we can check for insulin resistance or potential diabetes, among other heart disease-related risk factors, and adolescents and young adults undergo lung function testing as well as non-invasive, straightforward methods to assess potential early heart disease risks in youth. These are similar to many tests that are done in the doctor's office, but these are research level techniques that are, again, non-invasive. Beyond the blood draw, there's no pain or other issues associated with the study. And we provide $80 to the adolescent and additional $25 for the parent if they participate as well in the study. And so I'll stop there for now and would welcome any questions or comments. This study has had tremendous support from multiple community boards in Manhattan, as well as the Survivor Steering Committee of the World Trade Center Health Program, as well as 9/11 Environmental Action and a variety of leading environmental and public health groups. And so we're grateful for all of that support and would welcome any questions or insights. I'll leave behind some materials that describe our study further and my business card or others who might have questions, and we'd be happy to present, for example, at individual community boards or in various settings where we might be able to speak to parents and families about potential participation. Thank you.
And do any members of the Borough Board have any questions regarding that presentation?
It's the reason that it might be difficult this far out is that some parents want to, and adolescents might not want to dredge up memories of the disaster, and they might have early signs of health effects that might be the basis for further treatment and ongoing prevention. I mean, that was a very psychosocially traumatic event, in addition to children in early life who were exposed to the dust cloud. And similarly, the parents might have been extremely affected by what happened and might be reticent to participate, despite the potential health benefits. Well, of course, and we have the fullest support of the Department of Health, who have sent out mailings and followed up with phone calls, among other mechanisms, to reach out to these families. And so, insofar as we just simply want to ensure that the optimal communication is there. I mean, for some of these families, they've been lost to follow-up due to changes in address and phone number and what have you. So we're just trying to be as comprehensive in our approach as possible, so that we can provide the best information to the community regarding the potential health consequences of early life exposure to the World Trade Center disaster.
This is your program?
That, I believe, is the brochure for the World Trade Center Health Program, which is for the clinical care. My colleague Kimberly Flynn is here from representing the Survivor Steering Committee, and I believe she's distributed those materials. Maybe I can suggest that we can distribute these as well. Thank you so much. And the purple pamphlets describe the pediatric study that we're conducting of early life World Trade Center exposure.
Could you talk about the sign-up process?
I'm sorry?
The sign-up process, what is the process for getting participants to sign up?
Sure. So our staff can be contacted at any time via email or telephone, and we can certainly follow up with families to discuss the study, go through the screener, and see if there's a match.
What is the time frame for the study?
We have another year that we're conducting the study. We'd like to complete our recruitment as soon as possible, because this is a long-awaited study by the community as well, and so we're interested in providing as rapid and appropriate results, because if we find something of concern, naturally the question will be, well, what do we need to do to prevent and treat populations that may have been affected?
Any additional questions from members of the Borough Board?
What is the liability of your findings? Would your legal liability? Who takes liability of your findings?
Well, the World Trade Center Health Program provides care through a federally funded program for conditions that are substantially likely to be linked to the disaster. So there's a program in place where, insofar as a healthcare provider certifies that a condition is linked to exposure to the World Trade Center disaster, that automatically provides them care, insofar as their insurance or other resources don't provide for that care. So there's, from the perspective of the family, there's not any liability insofar as they have a health condition that can be linked to the disaster.
Any other questions?
So we're looking at asthma in particular, obesity, also early elevated blood pressure. In youth, it's more typically pre-hypertension rather than true hypertension, but in some cases we see that at an early phase, and insofar as there are clinically actionable values, we provide a report back to the family that can guide them for further follow-up, and we don't identify we don't refer people directly to individual healthcare providers because we want people to talk to their healthcare provider and decide what the most appropriate follow-up is, but we describe what the appropriate follow-up is and help them if they've got questions or concerns regarding the results.
I just want to make everyone aware that there are cards for the World Trade Center Health Program on the table. I also had an opportunity to speak with some of you before the meeting. So as Dr. Trisandi described, there's, the program funds the type of research that he's engaged in, which is an incredibly important study. And as he said, it's the first study, really, a deep clinical study of the physical health impacts to children who are exposed to the disaster. And then it also provides treatment. And my guess is, from my experience doing outreach for the health program, that everybody in this room knows somebody who was in this blue catchment area on 9/11 and in the months after 9/11. So we're trying to find people because the medical benefits this program provides are incredible. And what has been added in the last 2 years is care for a long list of cancers that have been deemed to be related to 9/11. And that care is provided at, some of the finest cancer centers in the city of New York, including Memorial Sloan Kettering and NYU, Dr. Trisandi's institution, and it's provided at no out-of-pocket cost to eligible individuals. So, I'm happy to get anybody more of these cards. We're happy to do presentations at individual community board meetings, and just, thank you so much. Thanks, Leo.
All right. Great.
Thank you so much.
Okay, we're going to move along now to our next presentation, which is a presentation by 32BJ SEIU on the Good Development Standards Proposal. And I believe we have Sharon here, 32BJ, who is here to present.
Good evening, everyone.
Good evening.
So my name is Sharon Cromwell. I'm from SEIU 32BJ. I'm the new development lead, so I coordinate our development campaigns or when there's residential and commercial development. We try to make sure that there are job standards attached to them. So I am here today. Well, first of all, thank you for having me here today. And so I'm going to be talking about our responsible development principles, which we think that are very important for all new development that happens in New York City. Okay, so before I begin, I'll just give a brief introduction or background on who 32BJ is. So we're the Service Employees International Union, Local 32BJ. We represent 145,000 building service workers along the East Coast, so in 11 states and Washington, D.C. The majority of those members, or about half of them, are here in New York City, so 70,000 work in the city, and 16,000 live in Brooklyn. And so they're building service workers. They're custodians, janitors, security guards. They work in public schools. They work in residential, multifamily properties, and they work in commercial, so offices and academic institutions, theaters, and so forth. And they represent a cross-section of New York City. our members come from 64 different countries, speak multiple different languages. Some of them are immigrants, some have a long history here in New York City. They're really a diverse representation of what New York City is. Can everyone see that? Okay, I apologize, I didn't bring handouts, but I can email that afterwards to Andrew, and he'll send them around. And so because of where our members live, they're New York City residents, and because of the work they do in some of the new developments, new development is very important to us. We believe that residential and economic development can be responsible and can have a positive impact on New York City and is a priority for the city, but we believe it has to be responsible. We believe that if it's done responsibly, it can have a good impact on neighborhoods and help address some of the public policy goals that the city and that this new mayor has set out, such as combating income inequality, making the city affordable, making the city resilient against any kind of natural disasters, and reducing our carbon footprint. And so we have some principles for what we think new development should have. And there's 4 basic buckets. So the first one is good jobs. We believe that development can create, it's not only, when we're thinking about residential development, for example, it's not only about building housing or building affordable housing, and those are very important and of course the primary goals, but it's also about creating good quality jobs that can help people be able to stay in New York City and provide for their families. So for building services specifically, we believe that new development should comply with prevailing wage requirements, which means good quality jobs with access to training, with access to time off, with access to benefits and retirement savings, and a wage that people can actually afford to, raise a family in New York City. And we also believe, of course, access to training is very important. Oftentimes, building service jobs are the gateway to the middle class for a lot of people, but we want to make sure that they have access to ongoing training so that they can move up the career ladder, which is obviously a priority for this administration. And we also believe that new development provides opportunities for minority and emerging developers, and so that the city, or whenever new development happens, the city, the community boards, elected officials should prioritize that. Affordable housing is another important principle of ours. Not only do 32BJ members work in the city, but they also live in the city. The picture right there is actually a 32BJ member, and she was volunteering on the election in 2014. And she wrote in that she cares about the election because she wants to continue to make New York City home. She lives in Brooklyn, her kids live in Brooklyn, her grandkids live in Brooklyn, and she's concerned about rising housing costs. And so, for that reason, and for obviously the reason that New York has a housing crisis, we find that affordable housing is a priority of the union. And so we want affordable housing that's real, that's affordable for, at what residents of neighborhoods that are becoming more expensive can actually afford. We want it to be accessible to local residents, for working families, for seniors. And we believe any kind of new development process should be open, accessible, and have meaningful community engagement so that communities can actually determine what their neighborhoods are going to look like, have a say on it, and that there's an engagement of multiple different stakeholders, including labor unions, including housing advocates, and of course lifting up the voice of community boards and elected officials. And the last major prong is environmental sustainability. And we think about this in 2 ways, right? Of course, we have to think about the way that the environment has an impact on buildings so they're resilient and they can withstand any kind of natural disasters like the one we went through with Hurricane Sandy, but also that development and buildings are developed, constructed, and maintained and operated in a way that's sustainable, that minimizes our carbon footprint. Because we all know that in New York City, the largest contributor to greenhouse gas emissions are large buildings. And so what can we do about the buildings that are being constructed and also ones that exist? And we know that 32BJ members who maintain and operate buildings have a role to play in that. And so that's an important prong of our new development approach. So that's actually, those are our buckets of priorities. And I'm happy to take any questions you have about that or make any presentations at the individual community boards. But I also want to just give some examples of developments that we are thinking about now. or projects. So one of them, of course, is the East New York rezoning. And we are working along with other labor unions and community groups and local development corporations to engage on that process and to make sure. So in East New York, we have about 3,032 BJ members that live there, and they're very interested in what's going to happen to their communities and engage in that process. So we are active in that process and are kind of, tentative, waiting to see what's going to happen, and are going to make sure that our members have a say, in what their community development looks like and the rezoning looks like. Another project that we're interested in is a project in Williamsburg. It's at 249 Wallabout, and it's a 700-unit mixed affordable and market rate development, and we think that's another opportunity to make sure that we're being advocates for the community and advocating for good quality jobs in that large property. And also Industry City, which is in Sunset Park along the waterfront. It's a large commercial site. It's 6 million square feet, and it can possibly be rezoned to accommodate academic, retail, and light industrial uses. So that's
What was the address of the second development you mentioned?
the Wallabout. It was 249-324 Wallabout. It's in Community Board 1.
Any questions from members of the Borough Board?
Is there any thought that, there's been a lot of analysis that the rush to build residential, even when it's affordable, actually pushes out manufacturing jobs, which are higher paying, better quality jobs in the city, leaving people unable to pay any rent when they have no work?
Yeah. I think that, I think that's important. That's an important, and I think we're in the process of developing how we can be in solidarity and stand with other people who are advocating for the maintenance of industrial and manufacturing uses. And I think they provide those are middle-class jobs often, and some of the jobs that are being created when uses go towards retail or other kind of commercial uses are lower paid jobs. So how can we both maintain good quality jobs and then raise standards in the jobs that are being created in the retail sector also is something that we're thinking about. But yeah, I think that is a tension and a reality of something that's happening in the city.
Could you explain what you mean about Sunset Park in detail?
So we're looking at the Sunset Park development. It's Industry City. It's being developed by Jamestown. It's a 6 million square feet, 16 different buildings. Currently, there is some storage there. There's also some retail, and I think a little bit of light manufacturing. I think 3D printing manufacturing is happening.
What blocks?
Pardon me?
What blocks?
I'm not exactly sure of the address, but it's I think it's right behind the Brooklyn Marine Terminal. So it's right up to the waterfront. And that is city-owned property. I can follow up with you with that information, though. And so at 32 BJ, we're thinking about some of the commercial jobs that are there, the security jobs, and I think there's others that are interested in the retail jobs, and again, to just make sure that we're raising standards there. But I think larger than that question about the jobs that are being created is what other uses is that going to interfere with in Sunset Park? Like, what does the community have as a vision for what's happening in Sunset Park? And that's something that, we want to definitely be sensitive to and talk to the community about and see, what jobs would be possibly being displaced by this new redevelopment.
Have you contacted our district manager by any chance?
I don't know that information if someone else in the union has, but if that's a recommendation, I would glad to take it. Contact the district manager. Okay.
Have this discussion with him?
Can I follow up with you about that information? Thank you.
Any other questions?
Yeah, for your information, ma'am, you can just go to Industry City.
Can't hear a thing.
You can just go to industrycity.com. You'll probably be able to look at what the young lady was talking about earlier.
Still can't hear you, I'm sorry.
You can go to industrycity.com online, and you'll be able to see that project that she was talking about.
Okay, thank you.
So let me just qualify all of it. In terms of 32BJ, we're not affordable housing experts, and so more so we want to follow the lead of groups that are affordable housing experts who have been working on that issue in New York City, who know specifically, what AMI levels are really reflective of what the community needs and what they're asking for. And I think there's groups there that work and are engaging East New York residents around that. And so we want to, be supportive of that. Yeah. So the principles, like what I was presenting, is a global support of affordable housing. In East New York, I think we're more starting conversations with, for example, the Cypress Hill Local Development Corporation, who has been thinking a little bit more specifically around affordable housing, and some other groups that we're kind of at the stage of forging relationships with. So not as much digging into the nitty-gritty on the affordable housing, but we do have a more universal support for affordable housing in the city. And then for the prevailing wage jobs, I think we have specific, we don't think that some developments, some affordable housing developments, some smaller developments might not be able to sustain prevailing wage or might have more difficulty getting that. So we do try to think about, is there a size threshold? Is there a cost threshold or whatever it is where it's reasonable to make sure that those jobs could be prevailing wage? So we do want to make sure that all jobs created are good quality jobs, but we have like a tempered ask for that. Ongoing. The permanent jobs for maintenance. Yeah, so we have, there's other trades, the building trades and laborers and other trades are really active on that, and those are our partners as well, through our project called Build Up New York.
Tomorrow, the City Council's Land Use Committee is having a hearing on its Engines of Opportunity report, which recommended certain zoning proposals to protect industrial and manufacturing businesses in the city. I'm just curious about if 32BJ plans to testify at these principles as they intersect with the kind of jobs issues that are raised in that zoning proposal.
I don't think we're I'm not sure if we're going to be presenting at that meeting tomorrow, but I think, as I said, we're thinking a lot about industrial and manufacturing and how our principles around new development intersect with that. So I'd love to do more follow-up on that specific conversation. And thank you.
Would you be willing to bring your presentation to the community board?
I would love to.
Okay.
Yeah, that'd be great. Anyone that's open or wants that, please let me know. I can be here afterwards and follow up. That'd be great.
Is there a specific ask for the Borough Board that you want us to consider as well, or is this more for informational purposes? Is this more of an informational purpose presentation, or is there a specific ask to come with this presentation at this time?
I think in general we would love if individual community boards or the Borough Board would sign on to these principles and as a support of this ask. I don't know. That's I think like a long-term ask. I don't know if you're ready to consider that now. And then I can also work with individual community boards to also sign resolutions in support of these principles.
Any additional questions? Great. Thank you very much.
Thank you.
So I know we were joined by a few other members after I called the roll. So if I didn't call your name for the roll, can you please just say that you're here, if you are here? Community Board 6.
Matthew Pick, Councilmember Cumbo's office.
Okay.
Dinah Shell Gross, Councilmember Cornegie's office.
Okay.
Kenneth Chu, Councilmember Cosmo-Chaco's office.
Okay. And just everyone, please make sure before you leave to sign in on the attendance sheet so we have a record that you were actually here. This way, it double confirms the attendance that we take that you signed in as well. No questions, no issues. With that, we are going to move on to the resolution to approve the recommendation of the Department of City Planning application, special regulations for neighborhood recovery text amendment. Last month, we had a presentation by the Department of City Planning in partnership with the Mayor's Office of Housing Recovery and the Department of Housing Preservation and Development regarding proposed special regulations for neighborhood recovery zoning text amendments. This proposal is part of the city's commitment to help New Yorkers affected by Hurricane Sandy repair, elevate, and rebuild their homes. The text will be applicable to sections of Community Districts 13, 15, and 18 to address special conditions in these neighborhoods to simplify the documenting of non-complying homes for Sandy-damaged homes, allowing habitable space to be elevated and modifying zoning envelopes for narrow and shallow lots to more accurately reflect neighborhood character. That was a mouthful. A draft resolution was circulated to Borough Board members reflecting comments provided by Community Boards 13, 15, and 18. Nilas Klingel, Project Manager of the Zoning Division from the Department of City Planning, joined us back in April and is here as well. And he's available to take questions from members of the Borough Board during discussion of the proposed resolution. Welcome, Mr. Klingel. Thank you. If you want to come up here and just join us for this part of the meeting. And we will now discuss the Borough Board's resolution seeking modifications that will be explained by the Borough President's Land Use Director, Richard Garrett. Richard?
So, with feedback through the public process with the community boards, Community Board 15 had adopted it with one change to include Manhattan Beach. So this resolution identifies the section in the proposal where it deals with the maps in Appendix A, and in that particular map number 2, there's an area that right now does not include Manhattan Beach, so we'd be looking for that map to be modified to include the entirety of Manhattan Beach. And the other resolution reflects something that started with Community Board 18, which has to do actually more globally than just these 3 particular subsections of the neighborhood, but that all areas really that have been affected by the superstorm. So there are certainly households that will find it a challenge to come up with extra funding to pay their insurance, flood insurance, if they are not able to take their habitable space out of the flood zone. And then there'll be those who may need to refinance or take secondary mortgages, which will again challenge their available income. So in those cases, we're looking for economic relief that either the administration or city council in tandem might find ways that, whether it's low-cost loans, whether it's related to the real estate taxes or anything else that we haven't thought of, that steps be taken to try to help these households. That's the essence of the resolution.
The Borough President applauds Mayor de Blasio for signing legislation, I believe it was yesterday, that provides property tax rollback to those who had their post-Sandy related improvements reassessed at an increased value, which resulted in higher real estate taxes. And the Borough President urges the governor to sign on to this proposal so that the assessment rollback can become law. Though pre-Sandy level assessments will not be helpful enough to those households who are not financially equipped to undertake refinancing or secondary mortgages to raise or fix their homes. Part of the Borough Board resolution, as Richard just explains, calls for going beyond the rollback for those households with less means. At this time, I'd like to open up the floor for questions from any members of the Borough Board or their representatives. Ethan?
Hi, I'm Ethan Lustigo-Grably here on behalf of Councilmember Mark Traeger, who's the chairman of the Committee on Recovery and Resiliency. I just wanted to say that, we are supportive of this, and, really this has been created sort of a bottleneck within the Build It Back program, and we're supportive of anything that will, allow the victims of Hurricane Sandy to get back into their homes as soon as possible.
Thank you. Teresa?
We will be voting on the draft, not on the original text amendments. We will be voting on this draft.
We're going to introduce this draft formally into the meeting, and that the proposal that we introduce, the Borough President will be introducing, will be this text right in front of you.
This?
Yes.
Okay, now, for Manhattan Beach, originally you were mentioning 8 houses. Is that an accurate number?
Could you clarify eight houses, specifically what?
At the community board meeting, when it was questioned how many homes were affected in Manhattan Beach, where they couldn't prove documentation or were on that narrow lot. I believe the number was 8 homes.
I apologize, I don't have the figures in front of me, but I believe in the particular case of Manhattan Beach that 8 of the 14 Build It Back registered elevations had some sort of documentation problem that we were able to diagnose at this stage. I can certainly be glad to make sure that we follow up with you and that Build It Back follows up with you to confirm those numbers.
Thank you.
But again, the other issue is that there are a lot of properties that are like 30 feet or less, especially going into the eastern section of Manhattan Beach. Maybe they didn't have damage from the storm of any consequence, but because their elevations are such, at the time they realize they're going to be faced with this bill from the flood insurance, and then they go to realize what it's going to take to raise their home, they may realize they're not properly documented for any particular alterations that were made after the building was initially constructed.
Forward 100%.
Any other questions?
Did you mean to include District 18? Because I heard you mention 18, but I don't see 18 here.
There is a neighborhood recovery area in District 18, which is on a different map in the appendix, so it's not affected by this resolution that the Borough Board's considering. There's a neighborhood recovery area in Community District 18, and so there is a portion of Community District 18 which is included already in the text amendment that's been proposed. And I'm just saying that Community District 18 isn't mentioned in the specific resolution because it's not in the particular map. The map is broken up by geography in the text amendment. It's just a...
There are many maps that cover the affected areas, so for logistical reasons, Brooklyn was split to not be on one explicit map, so that the Canarsie section and related area was on a different sheet number.
And so this resolution would not affect the eligibility of Canarsie. Canarsie will still be eligible to take advantage of this text amendment.
But will this type of resolution be attached to the Canarsie?
Yeah, so in other words, the application that we're reviewing is for the covered areas of Community Boards 13, 15, and 18. So the first clause of this resolution covers the entire application that was submitted by City Planning. Our resolution includes an additional conditional statement saying that the maps that include 13 and 15 should also be extended to include the areas of Manhattan Beach. So that's an additional condition that we are adding on our resolution. So our approval, if we give it, will apply to all 3 boards with an additional caveat that it also be extended to those affected areas in Manhattan Beach. Did I get that right?
Perfect.
That makes sense, everyone? Everyone good on that?
Yes.
Okay.
And just to be clear, there's a limit of 5 years, I believe, right?
Correct. And then the 2-year additional time, to complete the project, correct.
Sorry, that's
That goes beyond the 3 affected parts of the community boards, so this is kind of a more expanded concept, so it's kind of timeless. Whatever can be done, obviously, would have to be figured out, but the idea is that people may start paying flood insurance and realize that they got a problem, and then people may, so people could correct that problem at a later date. They could be paying insurance for several years at a bit of a hardship, and then they decide they're now going to raise it, and then there may be reasons why it will cost even more. So you don't want to necessarily get rid of that concept so quickly. So it may be until really, as long as homes still potentially are below the flood level, it may be a provision you'd want to have in effect.
And I'd also just like to clarify that this is a zoning text amendment through the Department of City Planning. The Department of City Planning's only capabilities relate to changes in zoning and land use. So any sort of program or tax abatement or low-cost loan financing, anything like that would be something that the city would be tackling through a different agency. It's not affected by it. Sure, okay. Okay, great. Understood.
What was the 5-year window you mentioned?
It's a 5-year.
The term of the text
I think 5
amendment.
years, something, would you repeat
Yeah.
the 5-year?
The text amendment that we're proposing is going to be effective for 5 years. So in 2020, it will expire. In addition, so during that time, anyone can go to DOB and obtain plan approval or building permits under these regulations. After 2020, when the text expires, there's also a grace period of 2 additional years where homeowners can complete construction based on permits that they already received while it was effective.
The idea of having a time limit really is to encourage people to move forward and to make the changes to adjust to the new realities we're dealing with.
In the final paragraph, it's not completely clear to me from the writing what the 30% refers to, whether it's 30% of their income that's going to be spent on additional insurance, or if their total housing cost, including the additional insurance, is going to equal more than 30% of their
the latter
income.
part.
I don't think that's clear.
Do you want to recommend any modifications to the wording?
Yes. I want to modify it so that that's clear. Would you like me to draft it while I sit here? Does anybody else agree? I mean, that it's confusing? If it's just me. Yeah, I think it would be something like, in order to assist those households for whom additional mandatory flood insurance costs would, raise their total housing expenses to greater than 30% of their income, so that it's clear that the 30%. You guys hear what I'm saying? Did I say it properly?
We're trying to capture the flood insurance. We're not trying to capture somebody who's already has that is 45.
Right. That the reason you went above and beyond with your household payments was because of this added bill.
I'm finding it very difficult to focus.
So I'm saying that we say that paying more than 30% of their household income due to the additional housing costs, would that work by getting rid of the word on, saying due to the additional?
I like the direction that Don Shell is going in. I think that's
Well, you want to mark it up and bring it up to,
I'm going to try to write it.
right? Yeah.
Okay, in the meantime, any other questions from members of the Borough Board?
I have a question. The
Oh, my God.
flood zones were redrawn. What is the connection between the redrawn flood zones and the zoning resolution?
I didn't quite hear you. Could you maybe state that because of the trumpeting?
I know that the flood zones were redrawn after the last storm, so I wanted to know what is the relationship between those zones and the zoning that we're dealing with, the zoning resolution.
The elevation levels that come from that change. So zoning defines the grade level. Normally, it's based on average curb level across a property, but there are exceptions. So the concept of a base flood elevation, and I guess the newer term is the
Flood-resistant construction elevation,
yeah,
right?
flood construction elevation. So the flood construction elevation is your 0 point. Your 0 point could be 2 feet above the curb level. It could be 10 feet above the curb level. And that affects the envelope of how you can place your structure. And habitable space has to be above that flood construction elevation.
But basically, this text amendment already takes into account and expects as the baseline the new flood maps, not the prior flood maps.
How would someone who maybe cannot get their construction done within the 5 years, 5-year window, you have 8 homes, for example, you've got four homes that maybe can get their construction done, and the other 4 cannot realize it in time. How would they be affected by it, or could be affected by this?
Well, there's There's a total of 7 years when you factor in the 2-year additional grace period that follows the expiration of the text amendment. And then even after that point, there are vesting provisions that a homeowner would be able to avail themselves of that are just built into the zoning resolution. I think in the case of a single or two-family home, they'd have to reach substantial completion, which DOB, Department of Buildings, considers the shell of your home, basically. So the homeowner from this summer, should it be adopted by the City Council, has until 7 years from this summer to at least get the exterior shell of their home completed. And it's our anticipation that will be possible.
And the substantial completion efforts, it's an added cost, it's an added time frame. So really, the sooner people start thinking about the realities of how they cobble the funds together, the better, so that they don't have to rely on a substantial completion effort at the Board of Standards and Appeals.
Will there be any grants or loans available to people that don't have the money to do this work?
Well, to some extent, I can't answer that because, like I mentioned earlier, we're really limited to zoning and land use, but I would say that the Build It Back program is the recipient of federal HUD funds to rebuild, repair, elevate homes in New York City. So they are reopening the application process for homeowners who are attached in attached housing stock. In addition, they're reopening cases of people who were unresponsive or just opted out of the program. And Build It Back will finance 100% of whatever your construction costs are required to elevate or rebuild your home to the building code.
Did you say you're going to reopen Build It Back program?
I'm sorry?
You're going to reopen the Build It Back program for new applicants?
The Build It Back program is only reopening for new applicants in the case of attached housing.
It's already confirmed. Attached only. If you're detached, you're not qualified.
Or you're already in the program, right?
No, I'm specifically talking about one thing. Are you going to reopen the Build It Back program? Yes or no? If yes, what are the restrictions?
I'm not from 8 Build It Back, and so I'll be glad to put you in touch with someone from Build It Back who can answer your question with 100% certainty, but my understanding of the program right now is that they will be reopening the program for new applications for homeowners who are in attached housing stock that's attached to another Build It Back home. So, but I'll be glad to make sure that Build It Back gets in touch with you.
We'll get additional clarity on that. Any additional questions? How we're working with your policy up there. The language, so give them a minute and then we can proceed. Meantime, it's a lovely background.
It's very confusing.
Don't ever say Borough Board's not a fun party, right?
You know about it? You're going to reopen it?
So if there are no other questions at this time, if there are no additional questions at this time, the Borough President would like to introduce the following resolution to the Brooklyn Borough Board for its consideration. Be it resolved that the Brooklyn Borough Board recommends approval of the Department of City Planning application 150302ZRY, special regulations for neighborhood recovery text amendment, with the condition that zoning resolution section 64-A80, neighborhood recovery area maps of Appendix A, special regulations for neighborhood recovery be amended to modify map 2, neighborhood recovery areas in Brooklyn Community Districts 13 and 15 to include the neighborhood of Manhattan Beach. And be it further resolved that the administration and city council, in order to assist those households for whom the additional costs of mandatory flood insurance or alternative refinancing of homes, housing costs to pay for, I lost you here. Alternative refinancing. Lost you here, Dennis. I'll come over here.
Be it resolved that the administration and city council, in order to assist those households for whom the additional cost of mandatory flood insurance or alternative refinancing or secondary mortgages to fund the rebuilding or elevating of their homes would result in commitment of more than 30% of their household income to housing costs, by including the provision of financial assistance for homeowners to make such improvements through offerings such as low-cost loans, real estate tax abatements or exemptions, or other financial mechanisms.
Is there a second to recommend the motion? We have a second?
Second.
Okay. Members of the Borough Board that are eligible to vote are Community Boards 13, 15, 18, all City Council members, and the Borough President. So we'll start with the Community Boards. Community Board 13? Community Board 13?
Yes.
Community Board 15?
Yes.
Community Board 18?
Yes.
Councilmember Cornegie's office?
Yes.
Councilmember Cumbo's office?
Yes.
Councilmember Deutsch's office? Councilmember Levin's office?
Yes.
Councilmember Menchaca's office? Councilmember Traeger's office?
Aye.
Councilmember Williams' office?
Yes.
And on behalf of the Borough President's office, yes. Okay, that is 11 votes in the affirmative, 0 in the negative, 0 abstentions. The resolution has been approved. Thank you very much. Okay. That concludes our business related to the special regulations for neighborhood zoning text amendment. And now we're going to move on to our final agenda item, which is a presentation by the New York City Long-Term Care Ombudsman's Program on the current structure and proposed changes to the statewide Long-Term Care Ombudsman's Program. I believe Richard Danforth is here to present.
I don't hear a thing. These people make me think I'm dead. I can't hear nothing.
Good evening. And the music stopped. I don't know what's up with that.
It's for you.
Kind of like that. Again, my name is Richard Danford. I'm the Brooklyn supervisor for the New York City Long-Term Care Ombudsman Program. I really want to thank Andrew for inviting me. Before I get started, I just want to, if you don't mind, just by a show of hands, can I see how many people in the room know what a long-term care ombudsman is? Okay. That's not surprising. One. Good, good. We were in Albany a couple weeks ago, and none of the legislators knew what we were either. So I'm hoping to change that a little bit tonight. My goal is to let you know what a long-term care ombudsman is, to hopefully enlighten you a little bit about the status of nursing homes, assisted livings, and long-term care facilities in New York, and in particular in Brooklyn, and encourage you to go out and keep that subject matter at your forefront and be aware of issues impacting long-term care individuals. Back in the 80s, well, let me stop just a second, just to kind of paint the context. You've heard these kinds of numbers before, but I'm going to say them again because every time I hear them, I get pretty knocked back. Between the year 2012 and 2030, this is for Brooklyn, and this is from the Census Bureau. Between 2012 and 2030 in Brooklyn, the African-American population of people over 65 will increase by 104%. The Hispanic population will increase by 155%. The Asian population by 119%, and the white population by 54%. We are undoubtedly on the threshold of a demographic change of historic proportions. And when you want to talk about whether you can see the impact of that, perhaps the greatest, although it's going to impact our entire culture, nursing homes and long-term care is a place where it's really already impacting us. So just kind of painting that into context. The Older Americans Act, which is where long-term care ombudsmen were born, was passed back in the 80s. And that's when the federal government passed a number of regulations and laws trying to reform nursing home care to make it more, quote unquote, home-like. And along with that, they wisely felt that residents in long-term care facilities and family members and friends of those residents needed to have an ombudsman available who had no conflict of interest, no interest in the facility, was a neutral person to act as an advocate for the resident and the family members. And so the term long-term care ombudsman got written into the Older Americans Act back in the 80s. Now, consistent with a lot of federal regulations and laws, they left how that got implemented up to the states in large. In New York, the long-term care ombudsman program is primarily, the heart and soul of the ombudsman program are all volunteers. We do have an administrative staff in the New York City program, but we have 100, and last count was somewhere around 126 volunteers. There are a number of states that the ombudsmen are actually paid professionals that go into the facilities. The fact that we have a volunteer program gives us a challenge. The requirements of the Older Americans Act are that we try to have someone that goes into each facility 4 hours a week, at least, gets to know the residents, gets to know the families, gets to know the facility, and is available to respond to complaints or requests for clarification of issues or a variety of different things. The things that we respond to range everywhere from abuse, neglect, financial exploitation, all the way down to the food's too cold and everything in between. The Ombudsman, according to the Older Americans Act, is not a regulatory entity. We do not have the authority to fine someone, levy a sanction, close a facility. That was by design, that the Ombudsman is really, our goal is to solve any individual problem at the lowest possible level so that it doesn't elevate to the need to pull in a regulatory entity like Department of Health or whomever. Currently in the state of New York, they operate 34 separate local programs, and all of them volunteer-based. Just quickly, as some statistics from the state, in 2013, there were over 2,600 complaints investigated. More than 30,000 individuals were assisted with information and consultation. Regular visits of 78% of the nursing homes. I'm going to talk a little bit more about that in a second. 190 community education sessions, and volunteers contributed over 130,000 hours of services. Interesting numbers for New York City. In New York City, we have a population of 43,135 nursing home beds. Nursing homes, 177. If you add in assisted livings and adult homes, now I'm assuming you guys kind of have a general sense of what I'm talking about when I talk about these different types of facilities. Nursing homes are full-blown medical-based types of facilities. Assisted livings are a step down from that. Adult homes are kind of a board and care type situation with minimal supervision. But we have over 10,895 assisted living and adult home beds, and over 77 homes. I'll get to the Brooklyn stats in a minute. The Brooklyn Volunteer Ombudsman in 2013, you'll see on this page, it's got this line graph. I've just pulled up the top 10 complaints that we get from nursing home residents and their family members. I'm only going to highlight a couple of them. You can peruse this at your leisure, but staffing I put on the top for a reason, even though we didn't get as many complaints about staffing as we did about some of the other issues. New York State is one of the only states in the United States of America that does not have a minimum staffing requirement for nursing homes. I'm going to say that again. New York State does not have a minimum staffing requirement for staffing in nursing homes. I can tell you from the calls that we receive and the investigations that we do, lack of staffing is at the core of, I would venture to say, the majority of the complaints that we get. I just don't understand it. I really don't understand it. I've gotten complaints over the last couple of months. Actually, now we're getting complaints from staff themselves. We'll call us anonymously. And they will tell me things like, for instance, and this is not an exaggeration and it's not uncommon, I'll get a call from a certified nursing assistant, who are the heart and soul of nursing home care. And they'll say, we have 3 CNAs on today, and we have a floor of 50 residents to serve. Now, these are people that have serious medical conditions, and 3 people for 50 residents is absolutely inadequate. But there is no standard in the state of New York, and I as you can tell, I'm quite an advocate for it. There's been bill after bill after bill introduced. There's another one this year by Assemblyman Godfrey that's trying to establish a minimum staffing ratio in nursing homes, and there isn't one. The other thing I want to talk about briefly, because I know I'm last and I know everybody's ready to go when you're last, right, is under resident care, one of the subjects is overutilization of psychotropic medications. It's become a national issue. The Attorney General's office has issued reports at the national level. There have been reports at the local levels that there is a serious overutilization of psychotropic medications on nursing home residents. Psychotropic medications are designed to treat people with psychosis, people with serious mental disorders. They are not designed to treat people with dementia or Alzheimer's disease. Nevertheless, they are utilized very often, and I'm not going to get into the clinical debates about it, but I know for a fact that very often they are utilized to control behavior. And it's an issue that's come to the forefront, and you can plan on hearing a lot more about it. In New York State, 11 of the Brooklyn nursing homes, we have 42 nursing homes, 11 of those are in the top 25% of overutilization of psychotropic medications. Brooklyn has the #1. I'm not going to name the facility, but we have one facility here that's using psychotropic medications on over 53.8 of their population. It's a serious problem, and please be aware of it. And if anybody wants to talk about any of this stuff afterwards or have concerns, please call our office. And I realized I didn't put our phone number on here. Let me do that. It's the area code is 212-962-2720. 212-962-2720. And we have done some work. I have done some work with the community boards. Community Board 6, I believe it was, when there were problems with one of the nursing homes in that area that made it to the newspaper that were rather disturbing. Okay. Now I'm going to talk about the Long-Term Care Ombudsman and how New York implements it, and I'll try not to editorialize too much. New York State has more long-term care beds than any state in the United States of America. We have more long-term care beds than California, more than Texas, and more than Florida. We have over 100,000 long-term care beds, and yet we are 45th out of 50 in terms of percentage of state funding for ombudsman services. The state contributes 8% of the long-term care ombudsman budget. The national average is 40% of the long-term care ombudsman budget. The state provides about half the number of paid long-term care ombudsman staff as the national average. The national average is 2,000, one paid person for a little over 2,000 beds. New York, on the state average, is one paid staff person for over 4,400 beds. In New York City, it's laughable. I hate to say it that way, but the national recommendation is one paid person for every 2,000 beds. We currently have 5 paid supervisors, myself included, in the New York City office. If we were staffed one paid person for every 2,000 beds, we would have over 20 staff members. It is a very difficult job, and we are a pretty busy place. Despite a substantial increase in workload and responsibilities, they added assisted living homes and family-type homes to our requirements by law over 10 years ago, and yet the funding has remained unchanged for that amount of time. I do have to add a little caveat to that. There was a slight increase this year for the first time in over 10 years, But that increase barely brings us up to slightly more than our funding was over 11 years ago. And there's in the state, there's over 1,673 long-term care facilities, and yet there's only 896 volunteers. Now I'm going to jump, because I know I have a tendency and a reputation for being long-winded. But how this plays out in terms of the ombudsman, I mentioned that we have all volunteers, and it's supposed to be that every facility has an ombudsman that goes in once every week at least for 4 hours a day. In New York City, long-term care, and these are the pie charts on page 5 that I'm looking at right now. Long-term care facilities with and without an ombudsman, we have 21% of the facilities that are supposed to have an ombudsman have an ombudsman. 79% of the facilities do not have an ombudsman. And when you're talking nursing homes and assisted livings, we're talking a lot of people who have no other advocate. They're not able to speak for themselves. They may or may not have family that are able to speak for themselves, and yet in 79% of the facilities, there's no ombudsman. In Brooklyn, we have 42 nursing homes, 22 adult homes, and 172 family-type homes. Now, family-type homes are small facilities with 2 to 6 or 8 residents that are operated and owned privately by family members and community members. There's 172 of those. When you talk about potential for problems, it's pretty significant. We have no ombudsman whatsoever for any of the family-type homes in Brooklyn. For nursing homes and assisted livings, we have ombudsman in about 45% of the facilities. Okay. Does anybody have any questions? I know I've kind of ventured off on my own agenda items for not having enough ombudsman services. Yeah.
If you spend 4 hours in any sort of a facility, how are you helping people who cannot speak for themselves if you're only visualizing what's going on for 4 hours every blue moon?
That's an excellent point. The standard that they've put into the regulations is they expect 4 hours a week. It is nowhere even close what is necessary. We have some facilities in New York City that have 1,000 beds, and we try to put 2 or 3 ombudsmen in those facilities. The benefit of having somebody that goes in on a regular basis every week, even though it may only be 4 hours, 6 hours, they have a mission when they go in there. They get to know who the residents are, they know what their issues are, they spend time with different people, and it's a relationship that you develop. Certainly 4 hours a week is nowhere near enough, but if you're in there regularly on an ongoing basis, you really get to know the place, and you really get to know the personalities and the issues that are involved. One other thing I did want to add, though, that we have gotten involved in is each facility is supposed to have a resident council. They all have a resident council where the residents meet, and they're, by law, allowed to bring issues to the facility to be corrected. They're also supposed to, if the family members request to have a family council, they're supposed to have a family council. A lot of facilities do not have a family council. One of the things that I started about 2 years ago was identifying which facilities, in fact, do have family councils that raise issues. And I've created, working with a legal services group, MFY Legal Services in Manhattan, we've now started what's called the Alliance for New York Family Councils. And we have membership of 13, we have 13 nursing homes represented, we have over 23 family members represented, and we get together about every quarterly. We have a website now, so we do advocate on behalf of families. So I've jumped away from your question, but you're right, 4 hours is not enough. We do the best we can. And then the majority of facilities get 0 hours.
Is the lack of funding due to the recommendations of the Borough Commission? The findings of the Borough Commission?
Recommendations of the Burger Commission?
I don't know. I don't know for sure. My humble opinion is, and I'd mentioned to you earlier that we went to Albany to advocate for more funding a few weeks back, and the majority of legislators, again, like this group, had no idea what a long-term care ombudsman even was. And so it is, when I said at the beginning of my talk that I want to introduce this subject and ask you to go out and be aware of these issues and introduce it into your conversations, pay attention to articles and literature that are based on that. It's just not been held as a high priority whatsoever. And it's not been enforced by the federal government, by CMS or the Office of Community Living, they now call it. So there's no accountability for the states. And so to me, it's unacceptable that we don't have adequate ombudsman services. They are making efforts now. They're reorganizing the state. I'm not going to go into details where I mentioned there's 34 local programs right now. Next year, all of the programs are going out to bid, ours included, and they'll be included into 16 different regions. So they're trying to group the counties. But they're doing it on very little more money. And so I don't know how that's going to work to try to increase the coverage. But it just hasn't, people aren't aware of it, and people don't like to talk about nursing homes. People don't like to talk about getting older, and we need to change that. So.
It's hard to understand, or it's hard to hear about such a vulnerable population and such an under-resourced kind of watchdog over that population. Can you give us any comfort? Is it the case that DFTA or another New York City program is somehow supplementing what the state funding is not providing for?
I wish I had some good news for you. I really don't. And I'm a career advocate, patient rights advocate actually. Spent most of my career in California. I moved here a little less than 3 years ago because I have a daughter who's ready to have a child, so I moved here. So I don't know historically where that comes from, but I can tell you that the result has been that in the last couple of years, at least I would have to say 6 different programs around New York State in the sponsoring agencies that agreed to contract and provide the ombudsman services have literally given them up and handed them back to the state and said, we can't do this on this kind of money. And so as a result, the state long-term care ombudsman program has now recommended this regionalization, restructuring of the whole program to try to distribute the resources in a different fashion. We don't know for sure what the effect of that's going to be, but I can for a fact tell you that the funding is not much better at all. So I'm not sure. So I'm sorry, I don't have a good answer to your question.
And just as a follow-up, I don't feel like volunteers can necessarily supplement for the professional services of an ombudsman, but since volunteers are a big part of the program, can you describe a little bit your volunteer program?
Yes.
When do you take people in? How much training is required? And what kind of
Sure.
folks are you looking for?
Thank you very much for asking that question. And before I get into how we do the volunteer recruitment, I personally agree strongly with you that there's a real downside to having an entire program, the manpower being 100% volunteer. An ombudsman is not a regular volunteer job. You have to go through a week of training, 8 hours a day, and you have to be certified, you have to pass a test, and you have to be certified by the state after you've completed that training. But then when you go in and do the work, it's work. It's not a friendly visitor. We have to screen our volunteer applicants very closely. We have to monitor them. We have to introduce them to the nursing home environment. The vast majority of our volunteers are seniors themselves. We do have some younger people that do it, but it's almost impossible to do it if you're working full-time. I've got 3, I guess, in Brooklyn. Nancy Richardson over here is one of my volunteers. She deserves a round of applause. So you go through a week-long training, then you get certified by the state, then we take you out and introduce you to the environment, and we try to make sure that the facility that you're placed in is convenient for you to get to, for one, and it's one that you're comfortable in working in. But you're right, and it's incredible the amount of time and energy that goes into trying to maintain a volunteer corps of over 170 volunteers with no specific funding in our funding budget for recruiting and training volunteers. The state used to do it, and they don't do it anymore. They've relegated that down to the local programs. So And with this restructuring, it'll still be the same thing. We will be responsible for doing that. So to try to supervise that many folks over in Brooklyn alone, over 12,000 residents, and the volunteers that are involved, and recruit, and train, and maintain, and supervise, it's an undoable, quite frankly, to do it as it should be done, it's undoable under the current structure. I'd get in big trouble for saying this, I'm sure. Everybody hear the question?
No.
Okay.
No.
Okay. Yeah. How do we recruit the volunteers and how do we train them? I keep asking for a billboard, but there isn't money for that. We just go around to different volunteer fairs, volunteer groups. We go to community groups. We go to health fairs. We go speak at different senior centers. We do as much as we can to just get the word out. And it's very difficult to do. We get a lot of people that show interest because they think it's like a regular volunteer job, or it's like a hospital volunteer that runs errands for people and is a friendly visitor. Once they find out it's not that at all, a lot of folks decide not to do it. So, yeah. That's, Nancy? No, there's no specific incentives, no. You get a badge. We take people on a cruise at the end of the year around Long Island, or Manhattan. We try to appreciate them as much as we possibly can. We meet once a month in each of the different boroughs with our volunteer groups, and I try to shower them with as much praise and appreciation as I possibly can. But no, built into the system, there are no incentives.
I have a question for you. Who is supposed to increase your funding, or who could we write to or advocate to for additional funding for you?
The legislature.
Okay, New York State Legislature?
Yes, and this year, I can tell you, I did a lot of work in trying to get additional funding. To his credit, Assemblyman Simberwitz from Brooklyn introduced on the Assembly side to increase our budget statewide by $2.5 million, which I can show you stats, still doesn't bring us up to the national average, but it gets us pretty close. In the Assembly, in terms of aging programs, to my knowledge, there were no dollars devoted towards any of those programs. And the $2.5 million disappeared, and the speaker took that off the table. We got an additional $500,000 from introduced by Senator Volaski, who's up north, because he's one of those areas where the program gave their program back and said, we can't do this anymore. And so Volaski got us $500,000. But it's really hard, and like I've mentioned over and over again, we got to change the conversation, because I can't go try to educate legislators for them to increase our resource base when they don't have a baseline understanding of what we do in the first place. So it's all of our responsibility to start talking about these issues and carrying the message out there. But it's the legislature that, yeah.
My other question is this, I'm sorry. Do we have in Albany, is there a dedicated committee or anything that deals with the needs of the aging at all?
Yes, the New York State Office of Aging, and each house has its own aging committee. Assemblyman Simberwitz is the chair of the aging committee in the Assembly. And the New York State Office of Aging, their director, Corinda Crossdale, I think does an outstanding job and is really trying to carry the message, if you will. There are good people there. We just don't have adequate resources to do what we need to do.
This is a great program. I had the opportunity to use it about 2 months ago in South Carolina. And what I find is that people don't know about it. And in nursing homes, everybody's always talking about how people stick people in nursing homes and there's nobody to come to see about them. And this is an excellent program, and we certainly need to do something to get the word out there, to let families know that this program is available, because I knew nothing about it until I had to use it in South Carolina, and I got excellent results.
Thank you for sharing that.
Yeah, my question was related, for example, to the role that the volunteer would play. Is it go between the management of the institution and the patient or the resident of the home?
What's the role that we play?
Right, in terms of if there's wet bed sheets, if there's wet bed sheets or cold food, different things like that, she would be the one to bring it to the attention of the management?
Yes. Well, it depends on what the issue was. If it was the wet sheets,
Yeah.
there's a whole variety of problems that could be occurring there. One of the most common problems that we get in complaints is that I've been ringing the call bell for 45 minutes and no one's answering it. And evidence of that is a saturated bed sheet. So you could be going to administration saying what's going on, nobody's answering the call bell, but you'd also go to housekeeping and say, we need to change the
And
sheets.
various other things.
Yeah.
Various other things.
Yeah.
Thank you.
One concern, I work for Councilmember Cornegie, and I don't handle constituent services, but I am aware of some of the issues that families with seniors in long-term care facilities raise. And one fear they have is that if they complain, if they complain about a problem that they know has something to do with the facilities, perhaps poor staffing or lack of capacity, that it will there'll be retaliation for their complaint against their loved one, and so they're very reluctant to raise issues, or they're afraid to raise issues. Is there anything in your experience or in the volunteer training or in your work with families that deals with this issue of fear of retaliation?
Yeah. Excellent point. I really appreciate you bringing that up. It's a very common fear. There's language in both state and federal law that prohibits any retaliation. That's great, right? It doesn't really help you if you're the family member. You're like, right, it says it in the law. What am I supposed to do? It's a very real fear, and I can tell you that it does sometimes occur. However, that's where the ombudsman really can play a super good role, because we're not the Department of Health. We're not a regulatory entity. We are there to resolve any problem at the lowest possible level. We advocate for the resident, of course, but the facilities, if we can develop a good enough relationship with and we have, I think, with most of the facilities, they don't mind us being there. If we can work with them to resolve an issue at the lowest possible level, then it never gets to where somebody's motivated to retaliate because they're not operating under the fear of any kind of fine or penalty themselves. We're also really good at being stealth, and we can let people know that I appreciate you're concerned about potential retaliation, and so we will look into this to the best of our ability, without bringing it to the attention of the facility or whoever else is involved, until we can get some information and then come back to the family and say, what do you want to do about this? Failure to speak up is not okay either. And it's too many people give in to the fear of retaliation, and whatever the problem is absolutely continues and sometimes gets worse. So I would encourage those folks, if they come to you, to have them at least call us. The call is completely confidential. They don't even need to tell us their name in the beginning if they don't want to. But we will try to find a way to resolve their problem and deal with it in a way so there's not a fear of retaliation. But now, again, having said that, it happens sometimes. Yeah.
Take one more question.
Yes, would it be possible for you to make a flyer and send it to Andrew, and that way he can send it to community boards, and we can kind of get the information out at our community boards?
Absolutely. Yeah, no problem. I know I have done a couple of presentations to the WICA meeting that's held here and handed out those, but sure, be happy to get you that information.
Could you have one ready by Tuesday night?
And thank you so much for your interest and good questions, really good questions.
Thank you very much. I think when...
Andrew, I just have one other question. Sure. Are the resident councils of the nursing homes aware of the fact that there's supposed to be such a person, a long-term ombudsman? Because my dad was in a nursing home for months, and no one ever used that term. I never heard it.
The resident councils, everyone should be aware. The posters are supposed to be up according to regulation, so our poster should be up with our number, et cetera. Again, over 50% of the facilities, we don't have somebody in there. So, but of those facilities where there is an ombudsman, I don't know if I put in the statistics, we try to attend as many of the resident council meetings as we possibly can. So I don't know which facility that was, and it's not uncommon probably right now that people don't know what an ombudsman is or who's available or what number to call. Yeah.
Great. Thank you very, very much, Richard. I think one of the points that was raised was who can we advocate to. I think it'd be good if we wanted to consider sending a letter from the board. If the individual boards want to send letters as well, maybe in the fall as we're preparing for the next state budget, which will happen next spring. We kind of just missed the boat on it. We can start laying the groundwork for next year's efforts. Probably this fall we'll revisit the issue. Thank you very much, Richard.
Yeah, thank you.
I have just two quick updates I wanted to share with you all as well before we kind of move on. Kind of call it old business. Number one, I know a number of community boards have reached out to our office concerning the city council proposal to put term limits on community board membership, and I know a number of boards testified against that proposal. I didn't see anything about boards that testified in favor of it. I don't know if they did or not. If so, let me know. Manhattan testified. I don't know if anyone in Brooklyn testified in support of it.
No.
The borough president has joined the other four borough presidents in a letter in opposition to that proposal. To the proposal to term limit community board members. The borough president feels that it's a diminution of his powers and that we already have term limits, that everyone's up for reappointment every 2 years, and that your appointment as a community board member is not a lifetime appointment. You have to be reappointed every 2 years. I'll share that letter with you all at a future point, or not tonight, basically. I'll share it with you tomorrow. And the second issue, a few months back, we considered a resolution in support of Nicholas's Law, which required the safe storage of guns in homes that have children. Just want to let you know, I know the representative from Councilmember Williams' office left, but just last week, Councilmember Williams and the borough president introduced a city council resolution calling on the state legislature to pass that legislation. We're waiting for a hearing date, but as we hear more on that, we'll keep you posted as well. But just want to let you know that our resolution here led to the legislation, which will hopefully lead to the state passing its legislation as well. Any other old business?
Do you have any idea when we'll get the finalized reappointment lists?
My understanding is that should be going out this week. That is my understanding as of this afternoon. That will be sent out this week to all the new members. And
how do we explain to a board member, if you look at the appointments, it says that their term expired the last day of March?
Correct.
So technically you have an April meeting. I've received calls, why would I come to the April meeting? I'm not even on the board.
That's a very fair question to ask. And all I know is that they should be finalized by this week, and people should be receiving letters this week notifying them of their appointment status.
And it's very difficult for a quorum. We didn't have a quorum in February, and March and April, the meeting didn't start on time, of course, because we didn't have a quorum yet. So it's really...
No, I understand. I know, I understand, I hear you. Like I said, that should be finalized this week. You should all have the updated list by the end of this week, is my understanding as of this afternoon.
And also the letter that...
That's what, yeah. Okay. Any other old business? Any new business? Oh.
The letter that you were talking about, the borough president is writing a letter again.
Has already signed a letter in opposition.
Already was.
And we'll share that letter. There was a request from one of the boards to make that letter available to everyone. Obviously, we'll do that. We'll send that letter out.
Is it possible to email that to me tomorrow? We're having an executive board meeting tomorrow night, and one of the topics is this term limit business.
As soon as I'm able to get my email set up and get it to you, I will do that. I will be out of the office tomorrow morning, but as soon as I'm back, I will send that letter out. I promise. You'll have it by tomorrow night.
Oh, okay, thank you.
Any new business? Okay, our next meeting will be Tuesday, June 2nd. That'll be a very light agenda meeting, I promise. We have one issue to consider, and then the rest of the meeting will be devoted to our bylaws. I know people keep asking about when we're going to revisit the bylaws. June's meeting is our bylaws meeting, so.
Took a year.
Well, it's as light as we need to make it. So I will send out a copy of the bylaws as well, so you have a chance to review them, and just come prepared for the June meeting to discuss the bylaws, proposed changes, recommendations, etc. We don't have to take any action, but we've been kind of talking about looking at the bylaws holistically and comprehensively for a while now, and so we'll set aside time in the June meeting to do that.
This will be bylaws that will be
This is for the Borough Board's bylaws.
across the board.
The Borough Board's bylaws, correct. Do we have a motion to adjourn tonight's meeting? That was really fast. Do we have a second? All in favor? Any opposed? Okay, thank you, everybody.